So today we are doing the very challenging case of the revision lip lift and fixing also the alarplasty from both sides and trying to get it symmetric. So it's going to be challenging, and it's going to come down to just measuring. That's going to be critical because it's a combination of alarplasty and revision lip lift, so it's not an easy task. We have to try to minimize the amount of scarring that can be seen, and it throws off the measurements of alarplasty, so we have to take into account the scar of the lip lift as well to make sure we don't overdo on that side, which is patient's right side, so we can bring it down to match the other side. Hopefully it's not going to be simple, but I am very optimistic. So good, let's get it going. So we've done the markings, and if you see, the midline was identified at the tip and at the nasolabial junction. Then I decided to change the plan and do separate excision of the scar along the right nasal sill, just below that. And if you notice, we are preserving the sill because you cannot recreate the sill. And the elliptical excision is just a scar alone. It does not combine at any point with the alarplasty incision. And we have a very narrow area right there, but that should have plenty of vascular supply. I don't think that's going to be an issue. So right there is going to be separate, exact markings on the right and the left. And as we excise the scar, the right nostril should come a little lower, as the nasal sill is going to be pulled a little lower as well. So I think that'll achieve the best possible outcome. And we have to be meticulous with the technique and minimize or not use, Bovie if you can avoid it, or definitely only bipolar if you have to, very judiciously, because you don't want to compromise the blood supply to that island right there. That's the tricky part. So we'll have to be very careful in that area, and meticulous aftercare is going to be the key, and our patient is very dedicated, so I don't doubt that at all. So we are all done. As you can see, the nostrils have narrowed in a very appropriate fashion, and if you look closely on the right side, there are two incisions. The scar is separate, the scar excision is separate, and then if you look closely right there, that's the alar incision, and they're very close, just at one point right there. And we'll watch that island very closely, but overall I think it should do very well, and it's going to look much better than where we started. So we are post-op day number 5, and I'm very excited because I was concerned about the vascularity in this area, and especially the island of skin between the excision of the right upper lip scar and the alarplasty scar, and that has done very well. So today we'll take out the stitches. Post-op day 5 is appropriate, but I will use Dermabond glue to give it a little extra strength for the next week or so. And as we go along, we might use laser or something to make it even better, but right now we just gotta sit tight and let all the swelling and scarring and everything settle down. And the hardest part is over, so we are excited. Okay, so we are done. Stitches are all out. Dermabond has been applied, and this will secure the wound for at least another week, and then we are going to be in good shape. And we'll meet in 2 weeks.